Good morning, doctors. I am Dr. Larson A. Taruk, and I am tasked to discuss the anatomy of the neck. These are my objectives: to present and discuss the anatomy of the neck in terms of facial planes, neck spaces, muscles, neurovascular supply, and cervical lymph nodes. The neck is bounded above by the inferior border of the mandible, the tip of the mastoid process, and the external occipital protuberance. The lateral contours are defined by the palpable sternocleidomastoid muscles and the borders of the trapezius muscles. The palpable medial structures are the hyoid bone, thyroid cartilage, cricoid cartilage, and the thyroid gland when enlarged. So normally, the thyroid gland is non-palpable. The neck muscles, the cervical viscera, and the neurovascular structures in the neck are encased by sheaths of connective tissue called facial planes. Facial planes are divided into two: the superficial cervical fascia and the deep cervical fascia. The superficial cervical fascia is a single layer of fascia deep to the dermis. It envelopes the platysma and the muscles of facial expression. It spans from the zygoma to the axilla, clavicles, and deltopectoral regions. The deep cervical fascia is further divided into superficial or investing fascia, which envelopes the trapezius muscle and sternocleidomastoid muscle and contributes to the lateral aspect of the carotid sheath. The middle layer, or the visceral fascia, is further subdivided or composed of muscular division, which surrounds the strap muscles, and the visceral division, which surrounds the larynx, trachea, esophagus, thyroid, and parathyroid glands. The deep layer, or the prevertebral fascia, is composed of the prevertebral layer, which envelopes the paraspinous muscles, the scalene muscles, cervical vertebrae. It spans from the skull base to the coccyx, and it contributes to the posterior aspect of the carotid sheath. The alar layer is between the prevertebral and buccopharyngeal fascia and covers the cervical sympathetic trunk. The neurovascular sheath, or the carotid sheath, is a fibrous connective tissue and a confluence of each layer of deep cervical fascia that encases the following structures: the carotid artery, internal jugular vein, the vagus nerve, and the cervical lymph nodes. We go now to the neck spaces. These are potential spaces which openly communicate with each other. Some are contiguous with distant regions of the body, offering a route of rapid transit for infections. The neck spaces are organized by their location. In the face, we have the buccal, the canine, the masticator, and the parotid space. In the suprahyoid region, we have the peritonsillar, submandibular, sublingual, and the parapharyngeal space. In the infrahyoid region, we have the anterior visceral space. And along the length of the neck, we have the retropharyngeal, the danger, the prevertebral, and the carotid space. This is a neck CT scan in axial cuts, showing to us the different spaces in their respective location. So the anterior visceral space, which is all known as the pretracheal space, lies immediately anterior to the trachea, and it extends from the thyroid cartilage to the superior mediastinum. The carotid space is a potential space within the carotid sheath which extends from the base of the skull to the upper mediastinum. The retropharyngeal space is a potential space that lies anterior to the alar fascia of the deep layer and posterior to the bucopharyngeal fascia of the middle layer that lines the posterior pharynx and the esophagus. It extends from the skull base to the mediastinum at the tracheal bifurcation. That is why, if you have a patient presenting with retropharyngeal abscess, the most dreaded complication is mediastinitis. This is a lateral cervical X-ray of a normal patient showing no widening of the retropharyngeal space, while on the other side, there is already widening at the C2 level as well as C6 level and lucency within the retropharyngeal space consistent with retropharyngeal abscess. The danger space is a potential space that lies between the retropharyngeal and prevertebral spaces. The alar layer forms its anterior border and the prevertebral layer forms its posterior border, and it extends from the skull base to the diaphragm. The sympathetic trunk courses through this space. The prevertebral space, enclosed by the prevertebral fascia, the vertebral bodies, and the transverse processes, and it extends from the clevus of the skull base to the coccyx. It contains the vertebral artery and vein, the brachial plexus, and the phrenic nerve. Tuberculosis of the spine may breach the space and form a Pott's abscess. Now, for the muscles of the neck, the platysma are broad muscles located on either side of the neck. It is supplied by the cervical branch of the facial nerve, and it depresses the lower lip and forms ridges in the skin. The sternocleidomastoid muscle originates in the manubrium of the sternum and clavicle, and it inserts into the mastoid process and the superior nuchal line. It is supplied by the occipital artery and the superior thyroid artery, and innervated by the spinal accessory nerve, branches from the anterior rami of C2 and C3, and cervical plexus. The trapezius muscle originates from the spinous processes of the cervical and thoracic vertebrae, and it inserts into the spine of scapula and acromion. It is innervated by the spinal accessory nerve and the branches from the C3 and C4. The trapezius muscles is supplied by the superficial branch of the transverse cervical artery, and it acts by rotating, retracting, elevating, and depressing the scapula. The anterior cervical muscles, which is found in front of the neck, are composed of suprahyoid, infrahyoid, and the anterior vertebral muscles. The suprahyoid muscles are composed of geniohyoid, mylohyoid, digastric, and stylohyoid. And the infrahyoid muscles, which is commonly known as strap muscles, are composed of sternohyoid, omohyoid, thyrohyoid, and sternothyroid. The anterior vertebral muscles are composed of longus colli, longus capitis, rectus capitis anterior, and rectus capitis lateralis. The lateral vertebral muscles are composed of scalenus anterior, scalenus medius, and scalenus posterior. We proceed now to the triangles of the neck. The neck is mainly divided into anterior cervical triangle, this one, and posterior cervical triangle, this one, by the sternocleidomastoid muscle. The anterior cervical triangle is bounded superiorly by the inferior border of the mandible, anteriorly by an imaginary midline, this one, and posteriorly by the sternocleidomastoid muscle. The posterior cervical triangle is bounded anteriorly by the sternocleidomastoid muscle, posteriorly by the trapezius muscle, and inferiorly by the clavicle. The anterior cervical triangle is further subdivided into 4 triangles. First is the submandibular or digastric triangle. This one. This is the submandibular or digastric triangle. It is bounded superiorly by the inferior border of the mandible, anteriorly by the anterior belly of the digastric, and posteriorly by the posterior belly of digastric. It contains submandibular salivary gland, hypoglossal nerve, mylohyoid muscle, and the facial artery. The carotid triangle, this one, this is the carotid triangle, is bounded superiorly by the posterior belly of digastric, anteriorly by the superior belly of omohyoid, this is the superior belly of omohyoid, and the inferior belly of omohyoid, and posteriorly by the sternocleidomastoid muscle. And it contains the carotid arteries and branches, internal jugular vein, and vagus nerve. The muscular or inferior carotid triangle, this triangle, which is just inferior to the carotid triangle, that's why it is called inferior carotid triangle or muscular triangle, is bounded superiorly by the superior belly of omohyoid, this one, anteriorly by an imaginary line or an imaginary midline, and posteriorly by the sternocleidomastoid muscle. It contains the infrahyoid musculature or the strap muscles and the thyroid glands with the parathyroid glands. Lastly, the submental or the suprahyoid triangle. This is bounded superiorly by the symphysis of the mandible. When we say symphysis of the mandible, this is the center part of the mandible. Inferiorly by the hyoid bone, and laterally by the anterior belly of digastric. For the posterior cervical triangle, this is divided mainly into 2 triangles. First is the occipital triangle, this one. It is bounded anteriorly by the sternocleidomastoid muscle, posteriorly by the trapezius muscle, and inferiorly by the inferior belly of omohyoid, and it contains the accessory nerves, supraclavicular nerves, and the upper brachial plexus. The subclavian triangle, this triangle here, is bounded superiorly by the inferior belly of omohyoid, anteriorly by the sternocleidomastoid muscle, and inferiorly by the clavicle. It contains supraclavicular nerves, subclavian vessels, brachial plexus, suprascapular vessels, transverse cervical vessels, external jugular vein, and the nerve to the subclavius muscles. The common carotid artery divides into 2 main branches at the level of the superior border of the thyroid cartilage, that is at the level of the C4, into internal and external carotid artery. The lower part of the neck receives most of its blood supply from the thyrocervical trunk, which arises from the subclavian artery. Branches from the external carotid artery supply the neck and face, while the internal carotid artery gives off no branches in the neck. The venous drainage received by the external and internal jugular vein as well as the anterior jugular vein, which opens directly to the subclavian vein. The lymph nodes in the neck are integrated as a biological filtering station. Of the approximately 1,000 lymph nodes in the human body, some 300 are located in the head and neck region. The lymph nodes at the junction of the facial and internal jugular veins receive drainage from almost all parts of the head and neck region and are a site of predilection for lymphogenous metastasis in large percentage of malignant head and neck tumors. The normal cervical lymph nodes are neither visible nor palpable. With a normal configuration of the neck, lymph nodes that enlarge to a diameter of 1 cm or more can be palpated. This is a picture showing to us the different levels of cervical lymph nodes. Level 1 is the submental and submandibular group. Level 2 is the upper jugular group. Level 3 is the middle jugular group. Level 4 is the lower jugular group. Level 5 is the posterior triangle group. And level 6 is the anterior compartment group. The external neck receives a non-metameric sensory supply from the cervical plexus, that is C1 to C4, which emerges at the posterior border of the sternocleidomastoid muscle. We call that area as Erb's point. The motor components of the cervical plexus unite with the superior root to form the ansa cervicalis and supply the infrahyoid and the geniohyoid muscles. The glossopharyngeal nerve, vagus nerve, and the accessory nerve pass jointly through the jugular foramen to enter the neck. The cervical part of the sympathetic trunk lies behind the neurovascular sheath between the layers of the deep cervical fascia on the prevertebral muscles. Thank you for listening